A Washington bill that would add new language to existing state law about appropriate measures regarding vaccines to control the spread of communicable diseases received lopsided testimony in opposition during its public hearing before the House Health Care and Wellness Committee. Here with more on this is the Center Square's Washington reporter, TJ Martinell. TJ, tell us about this bill and what it would do.
Yeah, so it's House Bill 1531, and what it would do is it would add new language to state law. It's actually a very short bill, and that's what's kind of interesting about it. It has two main paragraphs that it would add. One says is kind of a generic statement about how it's the policy of the state that public health responses adhere to the best available science, which I can't think of any state that says otherwise. Like, second best is okay, not the best. I think the one aspect of it that's more germane and more relevant is the fact that it adds a paragraph that says state and local health officials must, within available resources, implement and promote evidence-based appropriate measures to control the spread of communicable diseases, including vaccines. They're not allowed to enact any ordinances, rules, or policies that prevent the implementation and promotion of such measures. So it's what many critics are seeing as a centralization of public health policy decisions that are normally determined by the local health department.
So then, what are proponents arguing in favor of this bill?
They're claiming that it's something that's necessary uh, for reasons that are kind of vague. I mean, the bill sponsor said that this was in response to other states prohibiting local health departments from sharing important information with the general public about vaccines. The problem is this bill really doesn't seem to be doing that because I mean, unless I can't think of any health department that prevents the spread of information. Obviously they want to prevent the spread of diseases, but this idea that they can't share information, and it's not like he's going to have to worry about this at a statewide level. Instead, what he's actually doing is kind of an opposite version of that, where they're saying it's being imposed from the state tops down. You have to provide this information, and you have to implement these measures, and you can't do anything to undermine them. So it's almost the opposite side of the same coin.
And is that along the lines of what critics have been arguing?
Yeah, their feelings on this is that this is taking away the autonomy and authority of local health officials to handle situations like, there's some breakout of a communicable disease. They're not going to be allowed to make their own decisions about what's the best way to deal with it in their region, because it may have or involve a different strategy than let's say you're in a very rural area. Your response is probably going to be very different from a county or a local health official that's dealing with a very urbanized, much more dense population, where it's probably much easier to spread than in an area where there's 500,000 people in the entire county. So that's kind of that one of their concerns. I think the other one is that the bill might lend itself open to interpretation because it's very general and I don't want to say vague, but it's very broad. It's not very specific in terms of what it actually does.
And so when they held the public hearing, they had it last week. How did that go?
It was very, as you said at the beginning, it was very lopsided in opposition. I mean, there were some health officials and several individuals who were testifying in favor, but it was a long list of people who were expressing opposition. And one of them was the Jefferson County Health Officer, Dr. Allison Berry, where she was saying how this would take away her ability to gain the trust of local citizens who may not necessarily trust government, but they trust her because they know her, she's local, and when she's advocating for something, they know that it's her putting her word behind it. Whereas this bill would force her to promote things that she may herself not approve of or not think is the best practices for their area. So that's, you had citizens testifying who were concerned with the last response back in 2020, 2021 to the COVID outbreak, and there was the government state imposed lockdowns on that. And so there's just concerns with how government responds to outbreaks of diseases, but also, it mentions vaccines, and there obviously were all sorts of local vaccine mandates. I mean, in King County, you needed a passport in order to go have a meal at a restaurant, showing that you'd been vaccinated before you were allowed in. So just there's still lingering apprehensions from that time period.
Well, TJ, thank you for your insights on this story. Listeners can keep up with this story and more at thecentersquare.com.